14 hours in a hospital. $87,000. That's what happened to Sarah Mitchell, a 34-year-old teacher from Ohio. She had health insurance through her school district. She'd been paying premiums for 8 years without filing a single major claim. She did everything right. Then one night, severe abdominal pain sent her to the emergency room at 9 p.m. The diagnosis came quickly: appendicitis. Emergency surgery. Standard procedure. Nothing complicated. By 11 a.m. the next morning, she was discharged. 14 hours total. The bill? $87,000. Now, insurance negotiated it down. That's what insurance does, right? They protect you. Except after all their negotiations, after her $8,500 deductible, after the co-insurance payments, after the out-of-network anesthesiologist bill that she had absolutely no control over because she was unconscious during surgery, Sarah still owed $31,000 out of pocket. She had an emergency fund, $12,000 saved over 3 years, gone in one night. She'd been contributing to her 401k since she started teaching. 8 years of retirement savings. She had to cash it out to pay the hospital. Penalties, taxes, the whole nightmare. A decade of financial progress erased. 6 months later, she filed for medical bankruptcy. Sarah did everything society told her to do. Stable job with benefits, health insurance, emergency fund, retirement contributions, and one medical emergency that wasn't even her fault, something completely random. That could happen to anyone, destroyed everything she'd built. Still think you're safe because you have insurance? Still think this can't happen to you? In the next 30 minutes, I'm going to prove to you that American healthcare is systematically transferring wealth from your bank account into corporate profits, and you probably don't even see it happening. I'm going to show you the exact hidden costs that are stealing hundreds of thousands of dollars from your retirement. And at minute 24, I'm going to give you 7 specific, actionable tactics you can use right now, today, to protect yourself and your family from financial devastation. This isn't about politics. I don't care if you're Democrat, Republican, Independent, or you don't vote at all. This is about your money, your family's future, your retirement, and why you're paying more for healthcare than your mortgage, while getting worse care than people in dozens of other countries who pay almost nothing. Because here's the truth nobody wants to say out loud. You're not a patient in this system. You're a profit center. And every single day, corporations are extracting wealth from middle-class families like yours, completely legally, and most people never even realize it's happening until it's too late. So if you've ever looked at a medical bill and thought, how is this even possible? Or if you've ever delayed going to the doctor because you were scared of the cost, or if you lie awake at night, worried that one medical emergency could bankrupt your family, this video is for you. Let's get into it. Let me tell you about the Martinez family. Real people. Real story. Miguel and Jessica, both 38 years old, living in a suburb of Atlanta. Miguel works in IT, pulls in about $72,000 a year. Jessica is a nurse, oddly enough, making $55,000. Combined household income of $127,000. Solidly middle class. 2 kids, ages 7 and 10. They bought a modest 3-bedroom house in 2019, the kind with a small backyard and a 2-car garage. They drive a paid-off Honda and a Ford with about 2 years of payments left. They were doing everything right. Budgeting. Saving $800 a month for their kids' college funds. Contributing to their 401ks. They had health insurance through Miguel's employer, a PPO plan, one of the good ones supposedly. They paid $620 a month in premiums for family coverage. That's $7,440 a year just for the privilege of having insurance. Their deductible was $6,000 per person, $12,000 family maximum. High but not unusual these days. Everything was fine until March 2023. Their 10-year-old son Dylan started complaining about headaches. Not the kind kids get when they don't want to go to school. Real, persistent headaches that wouldn't go away with Tylenol or rest. After 2 weeks of this, Jessica's nurse instincts kicked in. Something wasn't right. They took him to the pediatrician. The doctor did the thing and ordered an MRI just to be safe, just to out anything serious. And that MRI found something. A brain tumor. Now, it was benign, meaning non-cancerous, but it needed to be removed because of where it was located. The surgery was successful. Dylan recovered fully. Today, he's a healthy, normal kid. But here's what happened to family financially. The total hospital bill came to $347,000. Insurance negotiated this down to $178,000, which sounds like insurance doing its job until you see what the family actually owed. They hit their family deductible. Immediately, that's $12,000 right there. Then came coinsurance. They had to pay 20% of the remaining costs up to their out-of-pocket maximum of $14,500. Add in follow-up appointments, physical therapy sessions, medications that weren't fully covered, and the final damage to the Martinez family was $28,300 out of pocket in 1 year. Their kids' college fund, the one they'd been building for 7 years, completely wiped out. Their emergency savings that took them 5 years to build, gone. Miguel's 401k, he had to take a hardship withdrawal of $15,000. But here's how that actually works. To net $15,000 after penalties and taxes, he had to withdraw $19,000 from his retirement account. That's $19,000 that won't be growing for the next 30 years until he retires. And here's the part that absolutely kills me. Jessica is a nurse. She works in healthcare every single day. She understands insurance terminology better than 95% of Americans. She knew what pre-authorization meant, what in-network versus out-of-network meant, what a deductible versus an out-of-pocket maximum meant. And it still financially devastated her family. Think about that. A healthcare professional, someone who works inside the system, couldn't navigate it well enough to avoid financial ruin. If she can't protect her family, what chance do the rest of us have? This is the reality of American healthcare. You can have a good job, good insurance, savings, and you can do absolutely everything. And one medical emergency, something completely out of your control, can still destroy a decade of financial progress in a matter of months. Here's what most Americans fundamentally don't understand about healthcare costs. You're not even paying twice. You're paying 3 separate times for healthcare, and most people only see one of those payments clearly. Payment number 1 is your taxes. The United States government spent $1.8 trillion on healthcare in 2024. That's Medicare, Medicaid, veterans benefits, subsidies for the insurance marketplace, children's health programs, all of it. Where does that $1.8 trillion come from? Your taxes. For a median household making $75,000 a year, somewhere between $8,000 and $11,000 of your federal tax bill goes to healthcare programs. You're paying for healthcare through taxes whether you use those programs or not. Payment number 2 is your insurance premiums. The average family premium in 2024 was $25,572 per year. Now you might say, wait, I don't pay that much. My employer pays most of it. And that's true, your employer probably does pay the majority of the premium. But here's the secret that HR departments don't want you to think about too hard. That employer contribution is part of your total compensation package. It's money that, in a different system, could be going into your paycheck as salary. You're paying for it through reduced wages. It's invisible, but it's real. Payment number 3 is out-of-pocket costs. Deductibles, co-pays, co-insurance, services that aren't covered, prescription drugs. The average American family spent $6,197 out of pocket in 2024, and that's just the average. If you have any kind of chronic condition or a major medical event, that number skyrockets. Let's add this up. Taxes go into healthcare, about $9,500 for a median household. The true cost of premiums, including what your employer pays, $25,572. Out-of-pocket expenses, $6,197. Total annual cost, $41,269. If you're making $75,000 a year, that's 55% of your gross income. Going to healthcare in some form. More than half of everything you earn gone just to have access to medical care. Now let me show you something that should make you absolutely furious. In the United Kingdom, The average person pays about $3,200 per year total for healthcare, all through taxes, and that covers everything. No deductibles, no copays, no surprise bills. In Germany, it's around $5,800. In Canada, about $4,600. In Australia, $4,200. France, $4,900. Japan, $4,500. Americans are paying 5 to 10 times more than people in other developed countries. And we're not getting better care. We're not living longer. Our infant mortality rate ranks 33rd in the world. Our life expectancy ranks 46th. We have the most expensive healthcare system on Earth, and we're getting absolutely mediocre results. But it gets so much worse than just the sticker price, because there's a hidden wealth drain happening that almost nobody calculates. The opportunity cost. The wealth you're not building, because that money is going to healthcare instead. Let's say you're 30 years old right now. Based on current trends, you're going to pay an average of $30,000 per year in healthcare costs in various forms for the next 35 years. Until you retire at 65. That's over $1 million in total healthcare spending across your working life. Just gone. Not building equity in a house. Not growing in investments, not funding your retirement. Just gone to insurance companies and hospitals. But here's the part that should keep you up at night. If you lived in Germany or France or Canada, you'd be paying about $10,000 per year less for healthcare. That's an extra $10,000 every single year that could be invested. If you put that $10,000 into a basic index fund, earning a conservative 7% annual return over 35 years, you know how much you'd have at retirement? $1.38 million. That's the retirement account you don't have because you were born in America instead of Germany. That's the generational wealth you can't pass to your children. That's the financial security that's being systematically extracted from your family and transferred to corporate shareholders. American healthcare isn't just expensive. It's the single biggest barrier to wealth building for middle-class families in this country. It's a silent wealth killer, and it's destroying your financial future $30,000 at a time while you're too busy trying to survive to even notice. So why does this nightmare exist? Who's actually benefiting from a system that bankrupts families and destroys wealth? I'm going to show you the 3 entities that profit from your illness and exactly how they've built a system designed to extract maximum money from you while providing minimum care. Number 1, insurance companies. In 2023, the top 5 health insurance companies in America made combined profits of $69 billion. Not revenue, profit, pure profit. United Health Group alone, just one company, made $22 billion in profit in a single year. Their CEO made $24 million personally. Think about that. While Sarah Mitchell was filing for medical bankruptcy, the CEO of an insurance company made $24 million. Here's how their business model works, and it's brilliantly evil. They collect premiums from you and your employer, billions of dollars flowing in every month. Then their entire job becomes figuring out how to pay out to little as possible. They do this through a maze of deductibles, coinsurance percentages, out-of-network, out-of-network surprise charges, pre-authorization requirements that delay and discourage care, and straight-up claim denials. The average health insurance claim denial rate runs between 15% and 20%. That means if you file 5 claims, one of them gets rejected automatically. And here's the genius of it: most people don't appeal. They see the denial, they assume the insurance company is right, and they either pay out of pocket or they just don't get the care. The insurance company just saved money by saying no and counting on you not to fight back. They also play this game with negotiated rates. Remember the Martinez family? The hospital charged $347,000 for Dylan's surgery. Insurance negotiated it down to $178,000. On paper, it looks like insurance saved them $169,000. What a deal, right? Except the family still owed $28,300 out of pocket, enough to bankrupt them. The insurance company gets to look like a hero while you're still drowning in medical debt. Number 2, hospitals and health systems. American hospitals charge prices that have absolutely no connection to the actual cost of providing care. A bag of saline solution, which is literally just salt water, costs a hospital about $1 to produce. They charge patients an average of $500 for that same bag. That's a 50,000% markup. I'm going to show you examples from real itemized hospital bills. 2 Tylenol pills, the same ones you can buy at CVS for 10 cents each, $38 on the hospital bill. A pulse oximeter, that little clip they put on your finger to measure oxygen levels, single use, $245. A 15-minute consultation with a doctor, not a specialist, just a regular doctor who stuck his head in the room and asked how you were feeling, $1,250. A basic metabolic panel blood test, the kind that costs a lab about $12 to actually run, $850 charged to the patient. Why do they charge these insane prices? Because they can. There's no price transparency. In healthcare, you don't know what anything costs until after you've already received the service, and the bill shows up weeks later. And here's the truly perverse part. Most hospitals in America are technically nonprofit. About 60% of hospitals are nonprofit organizations, which means they don't pay taxes. But to maintain their tax-exempt status, they're required to provide community benefits. And you know what they count as community benefit? Unpaid medical bills. They call it charity care. So follow the logic. Hospitals charge insane prices. Patients can't pay. The hospital writes off the unpaid bills as charity care. That charity care counts toward their community benefit requirement, which justifies their tax-exempt status, which means they pay no taxes, which means they can charge even higher prices next year. It's a self-reinforcing cycle designed to extract maximum money while avoiding taxes. Number 3, pharmaceutical companies. Americans pay the highest drug prices in the world, and it's not even close. A vial of insulin costs about $5 to manufacture. In Canada, patients pay about $12 out of pocket. In France, it's about $8. In the United States, that exact same vial of insulin costs $300 before insurance. Same drug. Same manufacturer, same molecular formula. The drug Humira, which treats arthritis and Crohn's disease, costs about $77,000 per year in the United States. In the United Kingdom, same drug, same dose, $12,000. Americans pay 5 to 6 times more for the exact same medication. Why can pharmaceutical companies do this? Because they're legally allowed to charge whatever they want in America. Medicare, which covers 65 million Americans, was actually prohibited by law from negotiating drug prices until very recently. That prohibition was written into law in 2003, and for 20 years, Medicare had to pay whatever price the drug companies demanded. So you have insurance companies profiting by denying your claims, hospitals profiting by charging you $500 for salt water, and pharmaceutical companies profiting by charging you 5 times what they charge people in other countries for the exact same drugs. And all 3 of these industries spend absolutely massive amounts of money on lobbying to make sure this system never changes. In 2023, healthcare and pharmaceutical companies spent $750 million lobbying Congress. That's more than defense contractors, more than big tech, more than oil and gas companies. $750 million spent to protect a system that bankrupts families. Now, I want to talk about the costs that don't show up on any bill. The invisible ways healthcare is destroying your wealth and limiting your life in ways you probably haven't even considered. Hidden cost number 1 is lost investment. Returns. Let's run a real calculation with real numbers. Take a 30-year-old couple earning a combined $90,000 per year. Their healthcare costs between premiums and out-of-pocket expenses total about $18,000 annually. If they lived in a country with universal healthcare, they'd pay maybe $6,000 per year through taxes for full coverage. That's a difference of $12,000 per year. If they invested that $12,000 every single year from age 30 to age 65 in a basic index fund with an 8% annual return, you know what they'd have at retirement? $1.86 million. That's the retirement account you don't have. That's the beach house you can't buy. That's the comfortable retirement where you're not worried about money. All of that is gone, transferred from your family to corporate profits. Hidden cost number 2 is something called job lock. How many people do you know who are stuck in a job they absolutely hate because they can't afford to lose their health insurance? How many brilliant business ideas have died because someone couldn't risk going without coverage while they built their company? Studies show that employer-sponsored health insurance reduces job mobility by 25% to 40%. You can't negotiate for higher pay by threatening to leave because leaving means losing insurance. You can't take career risks. You're trapped. And here's what that costs you in real dollars. The average person who switches jobs gets a raise of 10% to 15%. If you're making $65,000 and you're locked in for 10 years instead of switching jobs every 3 to 4 years, you're losing approximately $180,000 in cumulative wages over that decade. Hidden cost number 3 is delayed medical care. A survey from 2023 found that 46% of Americans, nearly half, delayed or completely skipped medical care because of cost concerns. You find a weird mole on your skin. It might be melanoma, but the dermatologist appointment costs $300 and you haven't hit your deductible yet, so you wait. And sometimes you're wrong. Early-stage cancer treatment might cost $30,000 total. Late-stage cancer treatment averages $300,000 to $500,000. The system literally incentivizes you to skip preventive care because of the upfront cost, which leads to worse health outcomes, which leads to exponentially higher costs down the road. Hidden cost number 4 is the mental health tax of medical debt. Medical debt. Medical debt is the number 1 cause of personal bankruptcy in America. Over 60% of bankruptcies involve medical bills as a major contributing factor. Studies show that people carrying medical debt have rates of anxiety and depression about 40% higher than people without medical debt. That stress reduces your productivity at work, costing about $4,000 per year in lost earning potential. Hidden cost number 5 is generational wealth destruction. Your parents worked their entire lives. They saved money. They bought a house. They built up a retirement account. And then in their final years, they needed long-term care. Long-term care isn't covered by regular health insurance. The average cost of a nursing home in America is $108,000 per year. The average length of stay is about 2.5 years. That's $270,000. The house gets sold. The retirement accounts get liquidated. Studies show that 68% of middle-class wealth is lost to healthcare and long-term care costs in the final years of life. I want to share 3 more stories because statistics and numbers can feel abstract. These are real people. Story number 1. Linda Chun, 52 years old, living in Phoenix. Linda felt a lump in her breast in January 2022. She had insurance with a $7,500 deductible, and she didn't have $7,500 in savings. So she waited. By May, the lump was bigger and painful. It was stage 2 breast cancer. If she'd gone in January, it would have been stage 1, with a 99% survival rate. Stage 2 required mastectomy, chemotherapy, and radiation. Her treatment cost $240,000. She survived, but she'll be paying off medical debt for the rest of her life. She told me, "I chose money over my life because I was terrified of the bill." No one should ever have to make that choice. Story number 2. James and Patricia Rodriguez, both 67, living in rural Pennsylvania. James worked in manufacturing for 38 years. Patricia was an elementary school teacher for 32 years. They'd saved $340,000 for retirement. In 2023, James had a massive stroke. He needed extensive rehabilitation and in-home care. Medicare covered some, but not all. 18 months later, their entire retirement fund was gone. Patricia, at 69, had to go back to work substitute teaching. 40 years of work, erased by one medical event. Story number 3. Marcus Thompson, 29 years old, Chicago. Marcus is a freelance graphic designer making $70,000 a year. A freelancer, health insurance costs $520 per month with an $8,500 deductible. He went uninsured for 2 years while saving for a condo down payment. Month 23, someone ran a red light and T-boned his car. Broken femur, lacerated spleen, 3 days in the ICU. Bills totaled $287,000. He filed for bankruptcy. His credit is destroyed. He's living with his parents. One moment of bad luck destroyed his entire financial future. These stories aren't rare exceptions. This is happening every single day to thousands of American families who did everything right. I've shown you how broken this system is. Now, here are 7 specific tactics you can use today to protect yourself. Tactic number 1, audit every single medical bill you receive. Studies show that 80% of hospital bills contain errors. Request an itemized bill that shows every single charge, broken down line by line. Look for duplicate charges, services you never received, and upcoding. When you find errors, call the billing department, document everything, and dispute the charges. Know a woman who reduced a $45,000 bill to $19,000 just by auditing and disputing errors. Tactic number 2, negotiate everything. Medical bills are negotiable. Don't pay immediately. Call the billing department and say, I want to pay this bill, but this amount will cause me severe financial hardship. What assistance programs does your hospital offer? Most hospitals have charity care programs but don't advertise them. Ask for prompt pay, discounts, 20% to 40% off for immediate payment. Request zero interest payment plans. Offer settlements like $5,000 to settle a $15,000 bill. Tactic number 3, use a health savings account strategically. If you have a high deductible plan, you can contribute up to $4,300 for individuals, $8,550 for families annually. This money is tax-deductible going in, grows tax-free, and comes out tax-free for medical expenses. But here's the advanced strategy. Don't use your HSA for current expenses. Pay out of pocket, save receipts, and let your HSA grow. You can reimburse yourself decades later, with no time limit. If you max out an HSA for 30 years at 7% returns, you'll have $867,000 tax-free. Tactic number 4, know your insurance network before emergencies. Surprise bills often come from out-of-network providers at in-network hospitals. Before any planned procedure, demand written confirmation that all providers are in-network. For emergencies, the No Surprises Act protects you from most surprise bills, but you need to know your rights. Tactic number 5, use price transparency tools. Healthcare Blue Book, Fair Health Consumer, and GoodRx help compare prices. A CT scan might cost $400 at one facility and $2,500 3 miles away. For prescriptions, always check GoodRx. Sometimes cash prices with coupons are cheaper than insurance copays. Tactic number 6, build a medical emergency fund separate from your regular emergency fund. Look at your out-of-pocket maximum, usually $8,000 to $15,000. Save that amount in a separate account labeled Medical Emergency Fund. If something serious happens, you'll hit that maximum, and without money ready, you're going into debt. Tactic number 7, consider medical tourism for planned procedures. A $75,000 hip replacement in the U.S. costs $18,000 in Costa Rica, including flights and recovery. Countries like Mexico, Thailand, and Turkey have internationally accredited hospitals with U.S.-trained doctors. For planned procedures, this saves tens of thousands. This isn't just about individual bills. American healthcare is the largest transfer of wealth from the middle class to corporations in modern history. Every year, hundreds of billions of dollars flow from working families into corporate profits. In 2023, the top 10 healthcare corporations made over $80 billion in profit. That money came from families like the Martinezes, people like Linda Chun, retirees like the Rodriguezes. Meanwhile, you're working longer hours for wages that haven't kept pace with inflation. You're delaying retirement because you can't afford healthcare until Medicare at 65. You're staying in jobs you hate because you can't risk losing insurance. You're not starting businesses. You're not building wealth, just surviving. This is how economic mobility dies. Your grandparents could support a family on one factory income. Your parents needed 2 incomes. Your generation needs 2 incomes and still can't afford it. Healthcare costs are a massive reason why. But here's hope. You're watching this, which means you're aware. You can't fix the entire system alone, but you can protect yourself. Use these 7 tactics and talk about this. Share this video. Discuss medical bills with friends and family. We've been conditioned to treat medical debt as shameful secrets, but it's a systemic problem affecting millions. The system counts on your silence. You deserve affordable health care. You deserve to build wealth. You deserve retirement with dignity. Until we have that system, be informed, strategic, and relentless in protecting what's yours. Quick recap. American healthcare transfers wealth from middle-class families to corporations. You're paying through taxes, premiums, and out-of-pocket costs, totaling around $40,000 yearly. That's 5 to 10 times what other countries pay for better care. 3 industries profit. Insurance companies denying claims, hospitals charging $500 for salt water, and pharmaceutical companies charging Americans 5 times more. They spend $750 million yearly lobbying to prevent change. Hidden costs destroy wealth invisibly. Lost investment returns worth over $1 million. Job lock costing hundreds of thousands in wages. Delayed care turning small problems into catastrophes. Mental health damage. Generational wealth destruction. But you're not powerless. Audit bills. Negotiate everything. Use HSAs strategically. Know your network. Use price tools. Build medical emergency funds. Consider medical tourism. Talk about this. Share your stories. The more people understand how broken this is, the closer we get to fixing it. If you found this valuable, hit like. Subscribe for more content exposing financial systems trapping middle-class Americans. Drop a comment with your medical bill horror story. Let's build a community refusing to accept this as normal. Thank you for watching. Protect your wealth. Protect your family. Stay informed and strategic. I'll see you in the next one.